This is an example of a supine technique. That's a nice way to restore motion at the C1, C2 joint or the AA joint in the neck. So typically, a quick way to assess for rotational ability at the AA joint, as we know, is to flex the neck up in supine and then kind of swoop to the right, and then rotate left. So if it's restricted in flexion significantly, it's often an AA joint problem. So what we're doing in this technique is we're taking advantage of two things. Number one, we're taking advantage of some small muscles on the back of the neck, upper neck, that involve rotation, mainly the inferior oblique muscle. We're also taking advantage of habitual neuromuscular patterns where in most of us, if we turn our eyes one direction, we turn our neck the same way. We tend to have a relationship between our extraocular muscles and our neck muscles and mobility. So if the patient is limited, we'll say, with left rotation, I'm going to have her look left. So you ipsilateral eye motion to the direction that's limited. So again, if she's limited rotating to the left, I'm going to have her look left in a moment. The other thing I like to do personally as a clinician is I like to palpate right on that inferior oblique muscle. It's a nice way to kind of check my own manual therapy skills, palpation skills. Remember, the inferior oblique muscle runs between C1 and C2, so it goes from the transverse process of 1 to the spinous process of 2. So if I can palpate C2 spinous process, slide my hands in like so, my index finger is probably right over the inferior oblique muscle as long as I'm on a diagonal like that. If I come in straight, then I missed it. But if I have C2 under my fingertips and my index finger and I come in below her skull, I'm on C1 for most of that. That's going to be the fiber direction and the bulk of most of the inferior oblique muscle. So again, that's not necessarily for effectiveness of this technique, but it's kind of fun as a clinician to feel for that muscle to swell a little bit when I ask the person to move their eyes. So let's get back to her problem. We'll say she's limited with left rotation. So I'm going to have you, don't move your head, just take your eyeballs and look hard to the left. Just keep your eyes over there. I'll do my 7-second hold and then come back to the center. So again, I palpate just because I'm curious about the motion. It's not for therapeutic reasons. Look left again. Hold. Come back to the center. We'll do that one more time. Look to your left. And come back to the center. And then we'll go back up and we'll reassess. And when it works, it's quite dramatic to restore motion. So this is a nice technique because, again, it's done in a neutral position. It's a non-threatening position. It's a non-painful position. The patient is only contracting their eye muscles volitionally, so that moving the eyes one direction should not hurt or be painful, but the effects are quite dramatic. So nice technique, muscle energy to restore rotation at the AA joint or C1, C2.